Your inner nose swells while having sex. Here's the psychology and science behind it. It may sound strange at first, but one surprising change that can happen in your body during sexual arousal is the swelling of the tissues inside your nose. This isn't a myth or an illusion, it's a real physiological response connected to how blood flow, hormones, and the nervous system work during intimacy. Understanding this odd reaction reveals just how deeply connected sexual arousal is to the entire body, not just the genitals. When a person becomes sexually aroused, the brain activates the parasympathetic nervous system, often called the rest and pleasure system. This system causes blood vessels to widen, a process known as vasodilation, to increase blood flow to sensitive tissues. Most people associate this with genital engorgement, but the same mechanism also affects other soft tissues in the body, including the nasal turbinates, which are blood-rich structures inside the nose. As these nasal tissues fill with blood, the inner nose can become slightly swollen. This may lead to a stuffy feeling, a change in breathing, or even temporary nasal congestion during arousal or sex. For some people, it's subtle and barely noticeable. For others, it's quite obvious. This phenomenon is sometimes informally called honeymoon rhinitis or sex nose. From a psychological perspective, this response highlights how arousal is a whole-body experience, not just a physical one. The brain doesn't isolate sexual excitement to one area, it mobilizes multiple systems at once. Heart rate increases, breathing changes, pupils dilate, muscles tense, skin becomes more sensitive, and blood redistributes throughout the body, including to the face and nasal passages. Hormones also play a role. During sexual arousal, levels of nitric oxide, dopamine, and oxytocin increase. Nitric oxide, in particular, directly relaxes blood vessels, making it easier for tissues to swell. This is the same chemical that supports erections and clitoral engorgement, and it also affects the inner lining of the nose. For women, this response can be slightly more noticeable during certain phases of the menstrual cycle when estrogen levels are higher, because estrogen further increases blood vessel sensitivity. This is why some women report feeling more congested during arousal at specific times of the month. Psychologically, noticing such body changes can influence how a person experiences intimacy. Some may find it amusing or neutral, while others may feel self-conscious if it affects breathing or comfort. However, it's important to understand that this reaction is normal, temporary, and harmless for most people.